In the sprawling landscape of America's healthcare system, where trillions of dollars flow annually to provide medical services to millions, a dark underbelly has long persisted, one riddled with fraud that siphons off taxpayer money, endangers patients, and fuels crises like the opioid epidemic. This story begins not in a single moment, but as a culmination of systemic vulnerabilities that have plagued programs like Medicare and Medicaid for decades. Vulnerabilities that cunning individuals and organized crime rings have exploited with increasing sophistication. Medicare, established in 1965 to cover seniors and the disabled, and Medicaid, its counterpart for low-income Americans, together serve over 150 million people, but their complex billing structures, reliance on self-reported claims, and sheer volume of transactions, billions each year, create perfect loopholes for abuse. Fraud in these programs isn't new. Estimates suggest it costs the U.S. government anywhere from $60 billion to $100 billion annually, driving up premiums and out-of-pocket costs for everyone. The roots of such schemes often trace back to the early 2000s, when digital billing accelerated processes, but also opened doors to manipulation, and escalated further during the COVID-19 pandemic, when relaxed regulations for telemedicine and rapid testing created a gold rush for scammers. It was against this backdrop that the 2025 National Healthcare Fraud Takedown emerged, a monumental operation that exposed schemes totaling over $14.6 billion in alleged false claims, the largest enforcement action in history, charging 324 defendants and highlighting how greed can infiltrate even the most vital public services. To understand how these frauds started, we must delve into the origins of the schemes, which often began with opportunistic individuals spotting weaknesses in the system and scaling up through networks that spanned continents. Many originated from transnational criminal organizations, foreign-based groups that viewed the U.S. healthcare market as a lucrative target, much like cybercriminals' iBanking systems. These rings, frequently operating from countries like Estonia, Pakistan, and the United Arab Emirates, would recruit straw owners, front people with clean records, to purchase legitimate medical supply companies in the U.S. The process kicked off with data theft, hackers or insiders stealing personal information from millions of Americans, including Medicare beneficiary numbers, through breaches in health databases or phishing attacks. Armed with this data, the fraudsters would fabricate claims for unnecessary or non-existent medical equipment, submitting them en masse to Medicare for reimbursement. Artificial intelligence played a growing role here, used to generate fake consent recordings or automate billing to evade detection. What began as small-scale pilfering in the late 2000s evolved into industrial operations by 2025, fueled by the post-pandemic surge in remote health services and the ease of laundering money through cryptocurrencies and offshore banks. Kickbacks were the grease in these wheels, payments to recruiters who lured vulnerable patients, or bribes to complicit medical professionals who signed off on bogus orders without ever seeing a patient. One of the most egregious examples uncovered in the takedown was Operation Gold Rush, a scheme that alone accounted for $10.6 billion in fraudulent claims, the single largest loss amount ever charged in a healthcare fraud case. This operation started around 2022, when a foreign-directed network began systematically acquiring dozens of durable medical equipment companies across the U.S., using straw owners sent from abroad to pose as legitimate entrepreneurs. The fraudsters targeted urinary catheters and other supplies, items that Medicare reimburses generously, but are hard to verify due to their disposable nature. They stole identities from over 1 million Americans in all 50 states, submitting claims for catheters that were never ordered, delivered, or needed. The scheme ramped up rapidly. Companies would bill millions within months of acquisition, exploiting Medicare's automated payment systems that often approve claims without deep scrutiny. Proceeds were funneled back overseas through complex laundering networks, including a U.S. banker who facilitated transfers. By 2025, Medicare had paid out $41 million before red flags, unusually high billing volumes from new companies, triggered investigations. Law enforcement seized $27.7 million in assets, and $4.41 billion in pending claims were frozen and slated for return to the Medicare Trust Fund. 19 defendants, including 4 arrested in Estonia and 7 at U.S. borders, faced charges in districts like New York, Illinois, California, Florida, and New Jersey, illustrating the global reach of what began as a calculated infiltration of America's health infrastructure. Building on similar tactics, another major scheme in the Northern District of Illinois involved $703 million in false claims, originating from Pakistani marketing organizations that specialized in data theft and deceptive outreach. This fraud started with aggressive telemarketing campaigns, where callers posed as health advisors offering free screenings, tricking seniors into providing personal details. The stolen information was then sold to nominee-owned labs and equipment suppliers who billed Medicare for unrequested genetic tests, braces, or pain creams. AI tools created fabricated audio consents to make the claims appear legitimate, a technique that emerged around 2023 as generative technology became more accessible. Medicare and private plans paid out $418 million before data analytics flagged anomalies, like spikes in testing from areas with low elderly populations. 5 defendants were charged, and $44.7 million was seized from bank accounts, but the real damage extended to patients whose data was compromised, leading to identity theft and eroded trust in health services. Shifting to the opioid front, the Takedown exposed how fraud intertwines with the nation's drug crisis, with schemes that began in the shadows of the early 2000s opioid boom, but persisted despite crackdowns. 74 defendants, including 44 medical professionals, were charged in 58 cases involving the illegal distribution of over 15 million pills. These operations often started in pill mills, clinics, or pharmacies where doctors prescribed opioids without medical necessity, driven by profit from kickbacks or direct sales to street dealers. In Texas, for instance, 5 defendants ran a pharmacy that distributed over 3 million opioid pills, beginning with a corrupt wholesaler supplying excess stock under the guise of legitimate orders. Patients were recruited from homeless shelters or addicted communities, prescribed cocktails of oxycodone and hydrocodone that were then diverted for black market sales. The fraud escalated as telemedicine allowed remote prescriptions, bypassing in-person exams. A loophole widened during COVID. Investigations kicked off with tips from whistleblowers and overdose data patterns, leading to administrative actions by the DEA to revoke prescribing privileges for 93 entities in the preceding months. Wound care fraud added another layer, with 7 defendants, including 5 medical pros, charged for $1.1 billion in claims targeting elderly hospice patients. These schemes originated in the growing market for advanced wound treatments, where suppliers and providers colluded to apply expensive amniotic allografts to minor scratches without proper assessment or coordination. It started with marketing firms offering kickbacks to nurses for patient referrals, evolving into widespread abuse by 2024 as reimbursement rates for these products soared. In Arizona and Nevada, defendants ignored infection protocols, endangering lives for profit, a practice that began small but scaled through networks of complicit facilities. Telemedicine and genetic testing frauds, involving 49 defendants and $1.17 billion, traced back to the pandemic's telehealth explosion in 2020, when regulations eased to allow virtual consultations. Scammers set up fake platforms, using telemarketers to cold call beneficiaries with promises of free tests, then billed for unnecessary genetic screenings or COVID kits, In Florida, one defendant owned companies that defrauded $46 million this way, starting with deceptive ads on social media and escalating to bulk billing. Other schemes, totaling $1.84 billion across 170 defendants, included unnecessary diagnostic tests and theft of controlled substances, like providers in Washington and California stealing fentanyl from pediatric patients under anesthesia. The takedown itself was a masterclass in coordinated enforcement, brewing for years through the DOJ's Healthcare Fraud Unit, established in 2007 and expanded with data analytics in 2018. Investigations started with proactive data mining, spotting billing spikes, unusual patterns, or whistleblower reports, then involved undercover operations, wiretaps, and international cooperation via agencies like Eurojust. By June 2025, the operation culminated in charges across 50 districts, with seizures of $245 million in luxury assets, crypto, and cash. CMS blocked $4 billion in claims preemptively, showcasing a shift to prevention. Civil actions recovered $34.3 million from 106 defendants, emphasizing restitution.